Hi, it's Ben. Welcome to the Managing Eczema YouTube channel. In this video I'm going to talk a little bit about tests and some treatments which can help to manage eczema. When I first started to suffer from eczema when I was about 14 or 15, I went to see the doctor, my local doctor, general practitioner, and was given emollients, so a moisturiser, and also topical corticosteroids. I wasn't given any other tests, or no other tests were recommended, and that was what was generally prescribed to people with eczema. And looking back, I've now found out that there are potentially a number of tests which eczema sufferers can undergo which may help to identify some underlying deficiencies, infections or weaknesses which can increase inflammation in the body, decrease our immunity and contribute to the severity of our symptoms of eczema. And some of these tests might identify things which are actually triggering your eczema in the first place. And by knowing what they are, you can improve your health and hopefully eliminate some of the triggers and therefore reduce your symptoms. Just to say that I'm not a doctor or a nutritionist, so this is based on my own research, and obviously if you get any tests or undergo any treatment for eczema, you should talk to a medical professional, and you should sort of work together with them to identify what the problems are. But this might give you some ideas about what you'd suggest or to your doctor to see if he thinks it might be suitable. Okay, firstly, a blood test. So blood tests can show all kinds of things, including hormone imbalances, mineral and vitamin deficiencies, markers for inflammation or infection, dehydration, liver and kidney function and other organ functions. And because of that, they can be useful in sort of gauging a spectrum of an individual's health and looking for problems. Studies have shown that many eczema sufferers have low vitamin D and low vitamin B12, so that's something that you want to try to focus on by incorporating into your diet, but it's also something you might want to look out for, because studies have shown that you may have those deficiencies amongst others. Another blood test that can be used, which I've already mentioned in a previous video, is known as the radioallergosorbent test, or RAST for short, and that's used to investigate food allergies by measuring the body's immune response. So food particles are mixed with the blood and an immune response is gauged, and there seem to be varying sort of opinions on whether or not such tests are accurate, but I think most physicians agree that they can be useful in identifying allergies. So that's definitely worth undergoing, because it could save you a lot of trouble with an elimination diet and might help you to identify some foods or I don't know, some other potential allergens like dust that are going to be a problem for you. Another test that you can take is a digestive stool analysis. So you can get a complete gastrointestinal panel whereby your stool is basically inspected for things like yeast and fungal infections, parasites and bacterial infections, and it can also show the balance of some good and bad bacteria in the gut flora. And in previous videos I've mentioned that many naturopaths link imbalances in the gut flora to eczema, and imbalances in the gut flora have been shown to contribute to the development of allergies and eczema in young children. In addition, in some studies, most eczema sufferers have some sort of overgrowth of Candida albicans in their intestinal tract, and some parasites have been shown to trigger eczema in some eczema sufferers. So if you've got any of those problems, you might not be aware of it, so it's worth getting that test done to see if there's anything you can do to, I don't know, get rid of the parasites, or rebalance the gut flora through things like, I don't know, dietary treatments like food or a low carb diet, or whether or not there are any yeast or medication that you might be able to take which might help you. You can also get tests for your digestive system, so your stomach acid levels, your digestive enzymes, and also your liver function and kidney function. If you've got low levels of stomach acid and insufficient digestive enzymes, or you don't have enough bile production, that can impair the extent to which you're able to break down foods into digestible components, and may increase the amount of allergies, allergic reactions that you will have to foods. A lot of naturopaths, as I've said in previous videos, link something called intestinal permeability or leaky gut to eczema, and there have been some studies which show that children with eczema also have increased intestinal permeability. Now, if you can't break down foods properly, they're going to get into the digestive tract, and potentially the undigested proteins will escape into the gut. And if that theory is right, then that will contribute to your eczema. So you want to see if you do have any sort of weaknesses in that area, and see if there's anything that you can get prescribed, or if you can make changes to your diet in order to improve your digestion. In addition, the liver and kidney, it's useful to test them to see how well they're functioning. A lot of naturopaths attribute eczema to a process of detoxification, by which an overburdened kidney, the kidneys being the organs which are used to filter the blood, an overburdened kidney that's not able to filter the blood properly may result in the body relying on the skin for elimination. So the skin acts as a third kidney, causing eczema after eating, and then increasing eczema. Now, I don't know whether or not that's true. It certainly seems to make sense, because so many of us suffer either an allergic reaction or a detox reaction following eating certain foods. So it's something worth looking into. You can also get a breath test for what's known as small intestine bacterial overgrowth. And I haven't had this test, but it can show low stomach acid and fungal or parasite infections. So again, that can be useful. And you can also get skin prick testing for allergies. So that involves putting a small sample of a particular food or an inhaled substance underneath the skin and seeing if an allergic reaction occurs in the skin area. Sometimes those tests can be inaccurate again, but they can be useful in indicating quickly whether or not there are particular substances which an individual is allergic to. And then finally, a hair tissue mineral analysis. The results again are questionable. Some physicians don't think that they're valuable, but others think that they're very useful in gauging the levels of heavy metals in the body, things like mercury, aluminium, copper and arsenic. And some physicians think that heavy metals, particularly mercury poisoning, can lead to or exacerbate eczema. So I haven't seen any tests which prove that, but I don't think it would hurt you to see if you do have any metal toxicity. That can also be tested by way of a blood test. And it makes sense that if you do have some sort of toxicity to do with heavy metals, then inflammation in your body is going to increase, and your immune system may be impaired or overburdened, and as a result your symptoms of eczema might increase. So that's another thing worth looking into. I've had blood tests and they did show low vitamin D and B12, so that's helped me to sort of change my diet in order to work on that. I also had a digestive stool analysis and identified an overgrowth of candida, and I've managed to remedied that by changing my diet to a diet lower in carbohydrates, and so I think that they're useful. I also had food sensitivity and allergy testing, and did identify quite a few allergens, but it wasn't that useful for me at the time because I'd already done elimination diet and knew, but it can be a sort of a quick route, particularly if you don't want to do elimination diet, to see which foods that you're likely to be strongly allergic to. And in terms of treatments, I think because so many eczema sufferers become desperate and don't know who to turn to after their doctor just gives them a steroid cream and a moisturiser and tells them to go, that there are a huge number of products and treatments out there which have no scientific evidence behind them and aren't necessarily proven to be effective, but because, you know, eczema sufferers are in a bad way, they'll really try anything. And so what I don't want to do in this video is start telling you which cream is good and which isn't, and which which new treatment to try. I want to stick to the treatments that there is scientific evidence behind. And the first of those is application skin creams. So things like obviously moisturising creams, but also creams with some antibiotic if you've got an antibiotic, if you've got a bacterial infection in the skin, and also topical corticosteroids can have a tremendous impact, particularly in the short term. More and more studies are coming out about the potential long-term damage of topical corticosteroids, and I'll go into that in another video, but there do seem to be risks associated with the use of topical corticosteroids for a period of time over 2 weeks, and I'll link a study to that when I do the focused video on that particular topic. But in the short term, all of those creams, particularly the moisturiser, can be very, very helpful. You can also get what's known as allergy desensitizing treatment. So after you've had an allergy test, you can have a series of injections which involve repeated exposure to that allergen, the idea being to desensitize you to that particular allergen and readjust your immune system so that it doesn't overreact. And I took those, I had such a series when I was about 3 or 4 years old, I don't remember, and it may be that it helped because in a year's time, after doing it for about a year, my eczema did go away completely and didn't come back for sort of at least 10 years. So that doesn't mean to say that it was actually the injections that helped me at the time. It may be that I just grew out of it, or maybe my immune system developed somehow. So, and also there are studies which show that these treatments work, and there are studies that show that they don't. And the difficulty with the studies is that a lot of people don't comply with them, or they don't report back. So it may work, it may not. I mean, so that shouldn't necessarily be your first port of call, but it's something that you can try, and at least there have been some studies looking into it. And then finally, Chinese herbal medicine. So, Chinese medicine is basically a system that includes Chinese herbs either put on the skin or taken usually in the form of a tea, acupuncture, diet and exercise. And the tea is usually made of various medicinal plants, so you can go to a Chinese medical practitioner, a Chinese herbal medicine practitioner and get a prescription for herbs. And there have been studies into whether or not the herbal medicines are effective. A lot of people, a lot of the more traditional doctors seem to dismiss them outright, but actually the scientific evidence shows that, some of the most recent scientific evidence shows that Chinese medicine is helpful for almost half of everyone that takes it, half of all eczema sufferers that take it after a period of 1 year. So a year after beginning the treatment, there's an improvement, sometimes a considerable improvement in the symptoms, and the eczema is actually reduced by up to 50% in some patients during treatment. So, there could be other factors involved, but that study does seem to indicate that Chinese herbal medicine can have an effect. So if you were to use, say, moisturisers coupled with some Chinese herbal medicine, change your diet as I recommended in the previous videos, and then looking to getting some of the tests to see if there's anything out, any other sort of weaknesses or infections that you can identify which you might be able to remedy, then you've already gone a big way towards managing your symptoms and taking action to improve your health. So I hope that's helpful, and if you've got any questions, let me know. If there's anything I've missed, let me know, and it'd be great to hear from you. Thanks for watching.